Susan here. I want to talk to you about some common questions that patients have about labiaplasty. First, what is it? The labia minora are those inner folds of skin that we all have that come in all different shapes and sizes. Sometimes they're longer than we prefer or asymmetric or have darkening along the skin edges that might sound familiar to you. None of this matters unless it bothers you. So a common question is, do I have to have this surgery done? And the answer is absolutely not. That would be like telling you that you need a breast reduction or a nose job. Of course you don't. It's just personal choice. But if you happen to have labia minora that are longer than you prefer and get in the way with certain activities like riding a bike or wearing yoga pants or sometimes even pull with intercourse, having that skin reduced can really help with your physical comfort and also improve your self-esteem if you don't like the way that it looks. But if you like the way it looks already, that's absolutely wonderful. There's no certain way that we should all look, it's just personal choice. A lot of patients also ask about what the procedure's like. So just beginning to end, once we've had our consultation and decided on what we want and agreed on the look that we're going for, I do recommend general anesthesia for this surgery. It takes about an hour and a half. There's no way to use local anesthetic, in my opinion, that can allow the patient to be comfortable enough. And your comfort is really a paramount concern for me, as well as, of course, your safety. So doing this with local anesthetic in the office, for example, could also raise some safety issues. What if you started bleeding or had some other issues that we might need to address? So this should be done in a surgery center, in my opinion, under anesthesia, so that you're totally comfortable, and should anything happen, we're equipped to deal with it. People often ask about the recovery. Well, I recommend 2 to 3 days after the surgery of laying low at home, using ice and taking pain medicine before you start getting up and about. After about 2 to 3 days, most patients are relatively pain-free. They usually say it's uncomfortable, and then it becomes itchy and irritable because there are a lot of stitches that, for obvious reasons, you just would rather not be there. But luckily they do dissolve on their own. It takes about 2 weeks. So after that first 3 days, you can usually return to light activities. Most patients take a week off work just to be sure, but you can work from home on your computer as long as you can rest and put your feet up. About 2 weeks of very limited exercise just while it's healing. And then at the 2-week mark, most patients can go back to just about everything with the exception of activities like intercourse or spin class or horse riding. Other than that, you can do most things. Now, every patient's different, but that's just a quick review of what to expect with a labiaplasty. Thank you.